Hello everyone, my name is Emepa Gimbana. I'm from MBBS 28, and it's a really excitement that we are here for celebration of our white coat ceremony. Since the day we met on the campus, we've been thinking of this day as it is an exciting day of transitioning from the basic medical sciences division to the clinical settings. We are very excited to meet the real patients and do our best to save their lives, apply what we learned in the class to the real life scenarios. It's a white coat ceremony. Everyone has to be happy for us. We are excited to meet our seniors there, the doctors, our faculties, and connect hands to help save lives and make the world a better place to be.
Hi everyone, my name is Jennifer Dixon and I just received my white coat today. I am part of the MBBS 2028 class and I am super excited going into the clinical education. I've just completed my preclinical studies in basic medical sciences and now transitioning to clinical medicine. Although it's going to be tough, applying all of this knowledge, this hefty knowledge that I learned from my incredible faculty here at UGHE, I know that these things will guide me throughout my clinical education, ease it in a way in this difficult journey that is yet to come. So I am excited, anxious a little bit, but just excited to put, a disease to a face. Treat the patient and not just the disease, as we're taught over here at UGHE.
To all of our students who are receiving their white coats today, congratulations to everybody. First, I want to congratulate every one of you on completing your basic science studies. I remember my enormous relief at being done with my preclinical education. I found the first 2 years of medical school very challenging, so I was happy just to pass my exams. I also want to welcome you to the wonderful family of clinicians, a tiny number of humans on this planet who have the great privilege of caring for patients as a medical doctor. We're so happy to have you as part of our clan. Remember, you were carefully selected to be a UGHE medical student by some very smart people, and we have great confidence in every single one of you. You are so lucky to be studying here in Rwanda. I've visited just about every country in Africa, and I can tell you that this country's commitment to universal access to healthcare, enshrined and enforced by President Kagame himself, is unmatched on the continent. Partners in Health has had the great privilege to support government-run hospitals in Butaro, Kirehe, and Rinkwavu, and the fundamental commitment of these hospitals is to provide the highest possible quality of care to all patients. Now, this may sound to some like just another high-minded slogan, but please know that many of us, including President Kagame, Paul Farmer, myself, and the whole team at Partners in Health, fought many battles against many foes to ensure that, for example, everyone in Africa living with HIV would have access to antiretroviral treatment. The result of these hard-won battles is that you will learn your core clinical skills at hospitals that put health and social justice at the core of their mission. Finally, I just want you to know how proud I am of every single one of you. I've had the great privilege of meeting and interacting with all of you over the last year and a half, and I feel so fortunate to be able to witness your growth as physician leaders. We have such high expectations for each of you. Please know that you are prepared for this next big step, and we can't wait to cheer you on as you make this important transition to the exciting world of clinical medicine. Congratulations.
The white coat has come to symbolize the noble virtues of compassion, integrity, and excellence that are intrinsic to the practice of medicine. It serves as a tangible representation of the trust and confidence that patients place in their healthcare providers. And to you, our students, as you don on this white coat, take it as a canvas upon which healing, compassion, and professionalism are painted. Your white coats are not just symbols of tradition, they are symbols of readiness to contribute to a brighter, healthier future for Africa and the world. As we venture into clinical practice, may your white coats be a source of pride, a symbol of your commitment to healing, and a reminder of the transformative power within each one of you.
You are now part of our team, and we are very happy to be here to celebrate you during this white coat ceremony. You have worked hard, you've taken your studies seriously, you have dedicated your time, your energy, your interest, sacrificed things, your families to get to this point. So I think we can all be next to you while you celebrate this moment, and this is truly something worth celebrating.
This third cohort of students that we will be receiving in the Butero Level 2 Teaching Hospital will be very impactful to the work of PIH because they've gone through a rigorous training of social medicine. They've been living in the community where they understand all the determinants of health from the people that they will be receiving. And they've also learned a lot about social justice. You've watched from the Hippocratic Oath that they made. They committed to be the best doctors that they could be. They committed to be compassionate. They committed to care for the patients that they'll be receiving. So we're confident that they will be providing equitable care for all, to all the patients that will be coming. And we are also very happy because this is the third cohort, so we're adding a new group of compassionate and passionate students who have become clinicians and will carry forward the work of Partners in Health, not only in Rwanda, in the community that they serve, but also in the world. And that will trickle down to the whole world in terms of what we'll be preaching, which is healthcare as a human right, and that we should be providing preferential health to anybody that comes to us, even if we're in a very rural area of Rwanda, or even if they choose to go to whatever rural area of the world, because that's also part of the commitment that they've made until they finish the contract that they've signed with the university.
UGHE has a unique curriculum. It includes the study of the liberal arts inside the medical school curriculum. What does this mean? It means that students will get a broad perspective. They'll have a pedagogy that has them question everything, really to become more focused on social medicine and the broader determinants of health. And from what I can see, it's being very successful.
UGHE is in this mission, has this grand vision of training the next generation of healthcare providers and leaders for countries in Africa, such as Rwanda, in the region, and the whole continent. Hence, they need to understand the context they are working in. That is why our curriculum is tuned towards first understanding the social situations they are practicing in. The social determinants of health, the geopolitical, the economical, anthropological, and social determinants of health are given serious emphasis in the curriculum. The most important reason is future leaders and practitioners cannot serve the community they do not understand, they do not know. And that is why our students spend significant amount of time in the community in our program called Community-Based Education. They spend time with the community, learn from the community, understand the community, and do projects with the community. They also spend significant amount of time in the hospitals to understand the common diseases they will encounter as general practitioners, to inspire them for a future career in specialty and subspecialty training. Times are changing. The continent of Africa is in this huge leap of growth. That means professionals who have the ability to think, to critically analyze information, and critically think, make decisions based on evidences are critically important. Diseases keep emerging every other year. There are pandemics coming now and then. There are new emerging non-communicable diseases, neglected tropical diseases. And that is why the concept of critical thinking and scientific reasoning is really important. We just don't want our practitioners to be just healthcare providers. We want them to be leaders, policymakers, influencers, leaders in the community, advocates. All these competencies that we expect from our students needs the competency of critical thinking and scientific reasoning. That is why we strongly focus on these two components.